Hi, today I'm going to show you the chest examination, the respiratory system examination. So to help me out, I have a subject and we are going to show how to first begin with making a patient-doctor rapport, how to make a rapport so that he is comfortable and he gives in himself for examination. Hello, मी डॉक्टर स्नेहा तिरपुडे. आई एम अ पल्मोलॉजिस्ट एंड मैं आपका छाती का तपास करने वाली हूँ. ठीक है, आपका नाम क्या है?
मेरा नाम पंकज है.
अच्छा, और आपकी एज?
32 ईयर्स.
ठीक है, तो मुझे सबसे पहले ये रिक्वायरमेंट है कि आप अपना शर्ट निकालें ताकि मैं आपका छाती का तपास कर सकूँ. We will do our inspection to begin with and the respiratory relevant general examination will be done. In terms of respiratory, apart from the normal TPR, that is temperature, pulse and blood pressure, we also need the respiratory rate, and so let me first show you how we're going to do the respiratory rate examination. So आपका एक हाथ दिखा दीजिए, मैं आपका पल्स देखना चाह रही हूँ. इस तरह से पकड़. So with our right hand we are feeling for the pulse, and with this method we are going to divert his mind, that as if we are doing this. Otherwise, if we directly start paying attention to his chest, then he might have an increased respiratory rate in return. So to avoid that, we divert his mind by feeling for the pulse, and we look at our watch, and at the same time we look at the chest wall and try to calculate the respiratory rate per minute. So we can also count it down to 15 seconds. So this is our respiratory system. ठीक है, thank you. One more way of finding out whether the patient has a change of voice or whether there is some slurred speech, so is the way that when we are starting to talk. So when he talks, apart from creating a rapport with him, I also come to know whether there is some voice change or there is some slurred speech. So we've checked his voice in that manner, because sometimes because of recurrent laryngeal nerve palsy, we can have that kind of change there. Change of voice can be there, especially in cases of apical tumors, apical lung tumors. So moving on to the other test is Pallor. Pallor is what I will मैं अभी आपके आँख के नीचे check करूँगी. We feel the lower palpebral conjunctiva. We just observe it and we look for the color of the conjunctiva. If it's red and nice and pink, that means it's normal. So the hemoglobin levels are expected to be within the normal range. And the other places that we can check for the pallor are the, आपके हाथ दिखाइए इसमें, हाँ, are the palmar aspects. ठीक है. So I'm going to check for any tremors, if any. Tremors are present when usually respiratory patients are taking beta agonist drugs, like for example salbutamol. So then I've got this paper. आप अपना हाथ वैसे ही रखिए, and I'm going to check for fine tremors. So we place a paper, a thin sheet of paper, and if the paper tends to fall off, that means there are tremors present. ओके, ठीक है, हाथ रख दीजिए नीचे. आई एम गोइंग टू शो क्लबिंग नाउ. आप अपना हाथ इस तरह से रखिए, 2 उंगलियां इस तरह से, हाँ, और अपने आँखों के सामने लाइए. एंड देन आई गो इन फ्रंट एंड चेक वेदर देयर इज अ डायमंड शेप देयर. सो देयर शुड बी अ डायमंड शेप एज सीन. So this is called a Scamroth sign, and the angle is called as Lovibond angle. This angle is obliterated in cases of clubbing being present.